Namaste everyone, I'm Dr. Renee Mehrra and today I'm talking to Dr. Aparna Bapat, who has over 2 decades of experience practicing Ayurveda in India, Europe and the United States. And she has been teaching in many medical colleges and Ayurvedic colleges across the United States. Dr. Bapat is practicing currently in Florida and is the president of the Ayurveda Association of Florida. Dr. Bapat also has started an herbal formulation company that was started like almost 15 years ago. It's called Ayurspirit, and it brings in pure natural Ayurvedic herbs in the United States. She has written numerous articles, given many workshops, and has been on many television shows in Europe, United States, and Canada. And she specializes in treating neuromusculoskeletal disorders, digestive, endocrine, psychosomatic disorders. And today we're going to be talking to Aparna Bapat on Autism Spectrum Disorder. Thank you very much, Dr. Bapat, for joining us. As we know, autism cuts across the board, and we see more boys likely to be diagnosed with autism spectrum disorder. 1 in 54 children diagnosed with autism spectrum disorder last year in 2020. And we need to bring that awareness of ASD, autism spectrum disorder, so that people who are watching the show can understand and get early intervention. I've been saying that again and again in many of my shows. Early intervention is the key. It can help us to treat children much better that way, so that they can live a very healthy life. And so Dr. Bapat, tell us, how does autism is understood in Ayurveda?
Thank you, Renee, for inviting me for this Autism Awareness Month and the show. In Ayurveda, we understand autism in a very different way. So we have to correlate the modern understanding of autism to the Ayurvedic understanding of one of the many disorders of Vata and the mind, one of which is called Unmada. So we try to correlate most of the understanding of autism as we know from Western perspective, and we can clearly see a lot of similarities between the Unmada disease of the Manovasrutas. So in Ayurveda, we understand there are several pathways that can host the disease pathology, and mind and intellect are one of the pathways that hosts this kind of autism spectrum disease. And based on the Ayurvedic fundamental theory of Prakriti or mind-body constitution, we can see that the whole spectrum of this disease comes out very live when we see numerous cases displaying a variety of symptoms. So we cannot really have a one-size-fits-all kind of approach when it comes to treatment, and that is exactly why Ayurvedic approach of understanding the disease and the treatment protocol really makes a big difference in people's lives. The kids who are suffering from this disease, because we can address each and every aspect of that spectrum based on the Ayurvedic understanding of Prakriti and Vikruti, and of course the Manas Rogas. Ayurveda also understands mind in a very special way. So it is not just the nervous system or the cognitive system or the different sensory impulses. It understands the processing of thoughts, emotions, and the processing of everything that we interpret in the form of knowledge or understanding through the various sensory organs, and then how we can relate and display our communication through motor organs. So in Ayurveda, we call this as a whole event of Dhi, Dhruti and Smriti. Like, we gather information with the help of sensory organs, we analyze and kind of try to make sense of all that information that our eyes and our tongue and our ears and our skin and our nostrils that have brought in all that information from the universe. And then all that analysis is then stored in the form of memory. So when we look at these autistic kids, the whole spectrum, you can very well see that some are very easy to grasp things, even things which are not in our realm. Some kids are really having a very different tangent in gathering or accessing information. Then some kids are having a lot of struggle in processing the information. It's not that they are blind or they cannot taste things or they cannot hear things. It's just the processing part. The organs are gathering the information, but the interpretation and the processing is where problems can happen. And then the third is like keeping it in different sections or compartmentalizing it in different ways of memorizing things. That aspect also, we see that some kids are really struggling to have that. So depending upon each category of the spectrum, we can basically help those kids on a very individual basis by analyzing their basic mind-body constitution and where exactly the dysfunction is happening, at what level.
So basically understanding, analyzing the individual constitution, the mind, the body, looking at it as an organic whole, looking at the imbalance, and then looking for the exact general and specific treatment that you talked about. Obviously, it has to be customized. As I said earlier, that 1 in 54 children is being diagnosed, diagnosed with autism spectrum disorder, according to the Centers for Disease Control and Prevention (CDC). Why is it? So let's go backwards. Let's go to genetics now, and let's look at the lifestyle of parents, their life trajectories. To keep them, to keep their child healthy, you have to start with the parents. So the lifestyle of the parents becomes very important for anybody, but especially with ASD, we're looking at it from the genetic side. So how do we control that part?
Right. So in in Western medicine or in Ayurveda, we always have, associated any kind of genetic dysfunction or any genetic issue to be like a bija dosha, or the flaw in the ovum and the sperm. And if we now look at the social conditions, lot of parents, lot of couples try to become parents at a much older age. So it's very common for women to have their first pregnancy in their mid-30s to even late 30s, and same with the men. Whenever that kind of age group couple has conceived a child, it has much higher chance of having some kind of birth defects, including autism spectrum disease. Well, this does not get diagnosed very soon, like it does not come up right after birth, but it takes at least first 2 to 3 years of the child's life to really come to a conclusive aspect that there is an autism spectrum disease involved, depending upon the milestones and the developmental parameters of that child. So in Ayurveda, we have a very a beautiful description or a protocol of suprajanan. So in the Vajikaran and even in the Kaumar-Bhritya, we have a very specific mechanisms or methodology how we can help the man and the woman who are trying to conceive to first of all have a very good balanced mind-body constitution. For that, they need to thoroughly cleanse their physical bodies by doing different panchakarma sessions. That is a complete rejuvenative and detoxification therapy in Ayurveda. We can also do Sattva Vajaya Chikitsa, which is catered to balance of the mind, because we know a lot of people are having stressful job and life situations. So this helps to keep a calm and balanced mind. All this contributes to formation of a very healthy ovum and sperm, what we call as Shukra Dhatu in the male and the female bodies. And if this kind of very balanced Shukra Dhatu is formed and a baby is conceived through that kind of union of balanced Shukra Dhatu, then certainly there are much higher chances of I would say almost close to 100% chances of having a very healthy child, a very healthy embryo. And then throughout the pregnancy, the 9 months of pregnancy, where the mother is hosting the baby and contributing to every aspect of the formation of the body tissues, the psychological emotional aspect of the baby, and all the tissues and the systems are formed. So we have masanumasik garbha sanskar. So every month the woman and the embryo that is growing inside her womb is given different types of suggestions about food and lifestyle, and different herbs that are very good to enhance the embryonic development at that particular time.
So what type of herbs was recommended at that
There
time?
are some common herbs that I can say, like shatavari and brahmi. They can be given during certain growth phases of the embryo. And then after this is also very important, not just during the embryonic phases, but after the child is delivered. If the child is delivered in a very healthy manner, like a non-stressful delivery by a Ayurvedic doula or a midwife who knows that the healthy or the natural birth process. And then after that, the postpartum care, which is almost 6 to 8 weeks after the child is brought into this world, how to take care of that, because those things, the suprajanan, the masanumasik garbha samskaras, and the postpartum care of Ayurveda, these play a very, very significant role in making sure that most of the birth defects or autism spectrum kind of disorders will not happen in the next generation. So if we create more awareness of this, of course we want to create awareness of autism spectrum disease, but basically how to prevent it, because Ayurveda has very definitive answers and methodologies to not even let those things happen, as we see them so prevalent in the society. So I think a lot of fertility centers and places where these kind of couples may end up going due to difficulty in pregnancy or infertility cases, we should definitely try to educate them about these aspects of Ayurveda, which will lessen the chances of having any kind of anomalies in the embryo or in the child.
So we're talking of right from Shukra Dhatu to the pregnancy stage, and then right after pregnancy, and then okay, we're controlling that part. Now we're talking about the environmental aspect, and we see that the child has autism spectrum disorder, and of course again early intervention is very, very important. That is the quintessential key over here for good treatment and to keep the child healthy and productive. Because many autistic children are very, very talented. We see that all the time. So hone in their skills, whether it's arts or music, or whether it's paintings or musical instruments, whatever they like, to, nourish them in a way that their skills are, brought out. But what would we did talk about is general herbs, and then there are specific herbs depending on the, managing the doshas and the imbalance that is created here, whether it's a Vata disorder, whether it's a Pitta or the Kapha disorder. So what would be some of the general herbs that you would recommend?
So as I earlier explained, that we definitely need to first analyze the prakriti of the child. So we can have a general understanding that any type of autism is a tridoshic. So all the three doshas are somewhat involved to lesser or greater extent. The pathology kind of leans towards Vata imbalance, just because it has the communication pathways are involved, the mind is involved, the nervous system is involved. So it kind of gears towards the Vata imbalance. And if we look at the individual constitution of the child, a Vata type of imbalance or the Vata type of constitution, if the child has, then that child tends to be very hyper, very hyperactive, attention deficit, or very restless, cannot sit still, cannot have any eye contact, can have very delayed milestones in terms of speech and other communications. Then a pitta type of constitution, or a child having pitta type of predominantly imbalance, will show a lot of anger, irritability, allergies, digestive issues, any kind of tantrum episodes of a very hyper degree. And then a kapha kind of constitution or a kapha imbalance that can be seen more prominent in those children. You can see that they are very kind of shelled in, they are very introvert, they're very timid, they are they just cannot have any skills of communication. They tend to be overweight and having a lot of issues about tactile sensory impulses also. So we see these different characteristics. We also see that some children have very exceptional abilities. Like in my over the years that I have seen so many autistic kids, and I've helped them to lead more of a normal, healthy life. I have seen that one particularly I can remember, this kid who had an exceptional ability to do mathematics. Any kind of numbers you give him, and he can multiply, divide in a split of a second. Another kid had an exceptional ability of finding any kind of precious metal or gemstone. Now, how I figured that out was a very interesting story, and of course, the parents tried to find that if that skill is real, and it was. So when he came to my clinic, he just looked at the earrings that I was wearing, and he's like, "Oh, these are fake. These are not real diamonds." And I kind of got interested to know how does he know about the minerals and metals. And he started communicating to me that he can stand on any piece of land if you take him to a beach or any open air field, and he can exactly say that underneath this particular place there is some precious metal like gold or some diamond or something. And the parents actually took him to the beach, and wherever he would spot, they would actually find something. So it was amazing that these kids on an average scale have no they cannot be conventionally taught anything. They have no normalcy in their behavior, but they can have an exceptional ability to do something completely out of context, out of norm, something that we cannot even think of, like this multiplication of 10, 15, 20 digits at any given moment. So these kids, what we try to do, give them certain general things. As I said, the vata is more prominent in the imbalance because of the mind and the communication pathways. So we give them all kinds of herbs that are very vata pacifying, and also they are like tonifying the brain and the nervous system. So a herb like Brahmi will really help them to develop these neuro pathways that can have some kind of issues. We can give that in the form of nasya. So there is Vachadi Tel Nasya, which we give for more of a kapha type of child having this autism spectrum. Then we can give Panchendriya Vardhan or Panchamhabhautik Taila Nasya. These will enhance the perception and also the cognitive abilities to interpret whatever their sensory organs have taken in. And also there are certain Brahmi can also enhance the memory aspect, because it is hard for them. They do repetitive actions, but it is hard for them to memorize a specific task you tell them or a specific format you try to educate them in. So the Brahmi helps in that. There is Ashwagandha, there is Jatamausi, there is Saraswati, there is Vacha, which is Saraswati and Vacha we also use for children who have speech related issues and delays or communication issues. So various ways to deal with them. The herbs can be given in the form of jams, like avaleha preparations. They can be given through the nasal pathways, because nasal pathway is supposed to reach to the brain centers, the frontal area of the brain, which has most of these neural pathways. Nasa hi shirasodwaram. So the nostrils are the closest pathway to reach a medicine or to deliver a medicine in the brain centers. So we use that. It's a little hard with these kids, but somehow we try to manage that also through the scalp. You can actually do the massage, chumpy massage, or hold or place a pichu, which is like a cotton ball soaked in Brahmi oil or any medicated oil
On the marma points,
around marma point, and it has to stay there for all night. We can also use different marma points on the body, like on the soles of the feet, on the palms, with a full body abhyanga massage. That helps for calming down a lot of these children with hyperactivity. So the vata type of kids with that spectrum aspect. So we have also the children have to be engaged into something creative. So when I see a lot of these pitta, anger, and the kids that have that kind of temperaments, and they also show skin and food allergies. So we try to help them with those aspects, like how to modify their diet, how to modify the environment that they're living in, how to create a better atmosphere and environment at home, and also how to engage them into some kind of creative task. A lot of them are very skilled in making things, so we can engage them with like some bead work or origami, or some kind of a work that will help them, that extreme amount of pitta which doesn't have a weight or outlet to dissipate and to come out, because a lot of the pathways are suppressed or blocked. So we open them up with the help of these herbs or with these techniques or lifestyle modification, and they can really see a lot of difference. They can almost live a normal, healthy life like rest of the kids growing up.
That's very, very important. These are special kids, with proper nourishment, with their herbs and healthy food, depending on their doshas, and of course, nurturing their talent and giving them a healthy life ahead. Thank you very much, Dr. Aparna Bapat. I am Dr. Renee Mehrra. Thank you so much for watching.